Hello everyone, this is Dr. Sangeeta Chaudhary and I welcome everybody to my channel again. In my today's class, I am going to discuss about palpitation. Now, what is palpitation? Palpitation is expressed as a feeling of thumping or pounding sensation in the chest. It is the unusual awareness of one's own heartbeat. Especially, patient becomes more concerned if they feel like they have missed or skipped a heartbeat. Usually, palpitation is seen commonly during rest. If the palpitation is associated with positional variation, then it may be associated with certain underlying structural heart disease, for example, atrial myxoma. And sometimes, in cases of mediastinal mass, also patient may have palpitation, which varies with posture. Now, coming to the causes of palpitation, there has been a large study which shows that palpitation is because of underlying heart disease in cases of in almost 43% of cases, and 31% of cases it is due to psychological disturbances or psychiatric illnesses. 10% cases it is due to some miscellaneous conditions, and 16% cases the cause remains unknown. Right? So, what are the common cardiac causes for palpitations? Cardiac causes for palpitations can be atrial and ventricular premature contractions. It may be due to supraventricular arrhythmias, ventricular arrhythmias, due to myocarditis, due to atrial myxoma, due to pulmonary embolism, due to aortic insufficiency. Now, palpitation can be, the types of palpitation can be regular or irregular, or it may be intermittent or sustained palpitation. Intermittent palpitation is usually as a result of premature atrial and ventricular contractions. If the palpitation is regular and sustained, it is usually as a result of sustained supraventricular and ventricular arrhythmias. And if the palpitation is irregular and sustained, it is mostly due to atrial fibrillations. Right? In cases of hyperdynamic circulations, for example, if there is catecholinergic stimulation in cases of exercise, stress, in these cases also patient may have a feeling of palpitations. In aortic insufficiency, palpitation is due to the enlargement of the left ventricle as well as due to hyperdynamic precordium. The patient usually feels or they usually have a sensation like palpitation. Right? Causes which can increase the strength of myocardial contractility can also give rise to palpitation. For example, use of tobacco, then cocaine, amphetamines, and theophylline, thyroxines, all this can give rise to palpitation. Other than cardiac causes, as I say, 31% of cases is palpitation is due to psychiatric causes. For example, it can be due to a panic disorder or anxiety states, or it may be a combination of panic disorder and anxiety and somatoform disorders, right? Now, how do you differentiate between psychiatric causes of palpitation and cardiac causes of palpitation? Usually the psychiatric causes of palpitation, they last for a longer period of time, usually more than 15 minutes, and they are associated with other psychological issues as well, or psychiatric issues as well. Among the other miscellaneous causes of palpitations, we have thyrotoxicosis, and ethanol abuse is also one of the important factors, and then spontaneous contraction of the skeletal muscle in the chest can also give rise to palpitation. Pheochromocytoma and systemic mastocytosis are other miscellaneous and some rare causes of palpitations. Now, coming to the evaluation of palpitation, how do we evaluate a case of palpitation? Our main goal for management and evaluation of palpitation is that we need to rule out life-threatening arrhythmias which can give rise to palpitation. Most of the time causes of palpitations are benign. Now, from the history, sometimes we can identify the cause of palpitation. If it is associated with coronary artery disease, the palpitation usually they have associated symptoms of chest pain, that is angina pectoris, and dyspnea. Palpitation which is associated with aortic stenosis or mitral stenosis or left ventricular dysfunction or hypertrophic cardiomyopathy, they are usually associated with dyspnea. Right? And on examination we really need to look for the vital signs, okay, and then we need to look for the jugular venous pressure and pulse waves, and we need to do a thorough auscultation of chest and precordium. It is very helpful if we ask the patient to tap out the rhythm of palpitation. It will help us to identify if it is a regular or irregular palpitation, or if it is an intermittent or sustained palpitation, right? On investigations, we can do electrocardiogram at rest if there is history of palpitation during rest. If palpitation is associated with exertion, then we can do an exercise electrocardiogram. And if the palpitation is not sustained, it is intermittent, then we need to do a 24-hour Holter monitoring, and sometimes extended Holter monitoring, that is 72-hour Holter monitoring. That means 72 hours recording of electrocardiogram we can do. Other than Holter monitoring, there are loop recorders which are implantable or sometimes external also, which are very helpful. And telemetry consultation is also very helpful, okay, where patient will consult you, or patient will be able to transmit the electrocardiographic recordings to the doctors whenever they sense the palpitation. This is how we need to evaluate the palpitation. Coming to the treatment of palpitation, as I said, most of the causes of palpitations are benign. They usually do not require treatment until it is very troublesome and bothering the patient. Cases of premature atrial and ventricular contraction can be treated with beta blockers. If palpitation is due to alcohol abuse or illicit drug use, then this requires abstinence, right? And if palpitation is because of pharmacological therapy, then we need to address this by considering alternating approach or alternating pharmacotherapy. If palpitation is because of psychiatric issues, then we need to address the issues by cognitive behavioral therapy and pharmacotherapy. And once we have ruled out life-threatening causes of palpitation, we really need to reassure the patient that the palpitation is benign and the palpitation will not affect the prognosis. It will not adversely affect the prognosis. Okay. So this is all about palpitation, which I wanted to discuss today. It is very important to know about palpitation because it remains one of the commonest complaints of the patients when they present in our OPD. Right? Thank you so much for listening to the class. I hope it was helpful.